And now we'll go into the exercises. So Eric from physical therapy will be demonstrating exercises that you can start working on.
My name is Eric Schloh. I'm the lead therapist here at the St. Cloud Hospital. I represent physical therapy and occupational therapy. You'll have both physical therapy and occupational therapy when you come in to have your hip or your knee replaced. So today we're going to go over what you can expect from therapy when you come in to have that done. We'll go over what we're going to do in therapy, when we're going to do it, and why we're going to do it, and we're going to discuss the goals of therapy. So in the nursing side of things, there's a lot of people that are going to be involved in your care from the time you come in to have your preoperative assessment in the clinic to the time you get up to the nursing floor. And then therapy is going to see you, the pharmacy is going to be involved, labs are going to be involved. Somewhere between 50 and 75 people will be involved in your care when you come in to have your hip or your knee replaced. The physicians all like to do things just a little bit different from one another. They like to time their medications a little differently. Some physicians use an immobilizer, some of them don't. Some of them like to use a drain, and some of them don't. But despite the physicians doing things a little bit differently and all these different people being involved in your care, the goal of therapy, the goal of having your knee replaced is the same for everybody that comes in, and that's to help you return to a normal function. Right now, your function is impaired because of the pain or the stiffness that you have in your joint. You're able to get around by yourself right now, you're able to do things for yourself, but you avoid certain things in your life that you may want to do because of the pain and because of the stiffness. After surgery, you're going to have a difficult time at first being able to do some of those things for yourself, being able to get dressed, being able to get up and down from the chair, things like that. You're going to have to get stronger, and you're going to have to get some motion back in your hip or your knee before you're able to do that for yourself. And in the meantime, until you reach those strength and mobility goals, you're going to need to use some adaptive equipment or assisted devices to be able to do this stuff for yourself. So that's where therapy comes in. So what is OT? OT is occupational therapy. I'm a physical therapist, so I like to joke with the occupational therapist that OT stands for the other therapy. But these girls are really good at helping you be able to take care of yourself after you have your hip or your knee replaced. If you think about all the things that you have to do in the morning to get ready, that falls into this category called ADLs, or activities of daily living. Being able to get in and out of bed, being able to get up and down from the toilet, in and out of the shower, being able to get dressed, being able to stand at the sink to be able to comb your hair or brush your teeth. That all falls into this activities of daily living that they're very good at. Imagine trying to put on your socks or your shoes, and now you can't lift your foot up, or you can't bend your knee far enough to be able to reach your foot. So how do you put your socks on? How do you put your shoes on? They're going to show you how to do that. They're going to show you how to use a sock aid. Now there's a lot of different devices they can show you how to use. There's sock aids, there's dressing sticks, there's reachers, long-handled shoe horns, a lot of different devices that they carry around with them, a lot of different equipment. They will show you what it is that you actually need for therapy, they will show you what you actually need for being able to take care of yourself, and then they'll make their recommendations. Before they make the recommendations, don't go out and buy a whole lot of equipment. The equipment isn't covered by insurances, and a lot of people don't need all the equipment. A lot of people only need one or two items. So after they see you, they'll mark on this sheet in your binder here. This is located right before the references section. Has a page of vendors in the St. Cloud area, has a page of vendors outside the St. Cloud area. So either way, you'll have some locations that you have options to pick from, and they have the devices across the top, the locations. You can go where you want to go to get the devices that you need. So they'll let you know what you need, and then you can go get them. Physical therapy. Now, as a physical therapist, I've heard everything that PT stands for. I added physical terrorist on here a few months ago. I like that one. That's kind of a new one that I hadn't heard before. Our focus is more on strength and mobility. Is your leg strong enough to hold you up? Is it strong enough to move you forward when you walk? Are you able to bend your knee, or are you able to bend your hip? Can you get up and down from the chair? Can you walk? Can you go up and down stairs? All these kind of major mobility things that we have to do every day, that's the focus of physical therapy. Now, right after surgery, you're going to have a hard time walking without using a walker or a cane or crutches. And physical therapy will show you how to use that assisted device the appropriate way and the most efficient way for you. So what are the goals of therapy? Why are we doing therapy? a lot of people come in and they know that they're going to have therapy, but why is it that people receive therapy when they're in the hospital if you're only here for a few days? Studies have shown that people who come in to have their hips or their knees replaced get out of the hospital quicker, and they have a better overall recovery if therapy is involved right from the start. Okay, so this is why we do therapy here. All these, if you remember what I just said about returning to normal function, all of these goals pertain to a normal function. We want to be able to get in and out of bed safely. We want to be able to walk with a walker or the cane or the crutches. We want to be able to go up and down stairs if you have stairs at home. Be able to get yourself dressed or get in and out of the bathtub. We want to be able to hand you the exercises, and you can do these exercises at home to continue to build strength and mobility in your joints without having that therapist stand next to you and continue to instruct you on those. We want you to be independent with those exercises. The motion in your hip and knee is very important to get back to normal function as well. When we talk about knee motion, in the booklet here it'll say 0 to 100 degrees, 100 being a little bit past that perfect L. So if you imagine a perfect L and going a little bit past that is going to be 100 degrees. And we picked that not just because 100 degrees is a nice and round number, but we picked that because it makes it easier to get up and down from a chair. Now with your hip, 0 to 90 degrees, so we want to get to that perfect L at the hip, that allows you to actually sit in the chair. And with both of these, you notice there's a 0 in front of it. So there's 0 to 100, 0 to 90. That allows you to get your leg all the way straight. When we're walking, we have to be able to get the leg all the way straight in order to walk efficiently and symmetrically from side to side. Okay. Now, the other thing is, if the physician has any precautions, anything that he doesn't want you to do, then it's therapy's job to instruct you on how to go about these functional tasks while maintaining those precautions. A common precaution may be that the physician doesn't want you to put all your weight on your leg. Then we have to show you how to use the walker, how to use the crutches, so that you don't put all the weight on your leg, so you only put part of your weight. This doesn't happen very often, but if there is a precaution, that's one of the more common precautions that we would have. The good news is most of the time with a hip or a knee replacement, there won't be any precautions that you have to follow. You'll be able to bend your knee or bend your hip as much as you feel comfortable, and you'll be able to put weight on your leg as much as you feel comfortable after surgery. If you have a traditional approach to the hip replacement, you may have some precautions which include not being able to bend your hip past 90 degrees, not being able to cross your legs, and not being able to twist your leg. If you do have any of these precautions, the therapist will let you know before we get you up and before we move with you. One thing with the knee replacements, we don't want you to kneel on your newly replaced knee, and we don't want you to twist. Where this comes into play is if you're trying to put your socks or your shoes on by pulling your foot up and putting your sock or your shoe on in that manner. The occupational therapist will show you how to put your socks or shoes on without doing that. Now, therapy will start for you on the day of surgery. You'll come in to have your surgery. You'll have your surgery, go to post-operative recovery, come up to the floor here, the nursing floor, and then a few hours later, physical therapy will stop by your room. What we found is that by starting therapy on the day of surgery, we're able to shorten your length of stay. People on average are getting out of the hospital about half a day earlier. Your overall recovery is improved, is quickened, goes better for you. There's less pneumonia and there's less blood clots. So all these things that happen as a result of not being able to move go away if we're able to get you up and moving right away. Now, what we do when we come to see you on the day of surgery is really dependent on what level that anesthetic and the spinal block are still working. If the block is still working and you can't feel your legs, you can't move your legs, we can't get you up on your feet because your muscles won't hold you up and you'll fall to the floor. If, on the other hand, the spinal block has worn off or that nerve block has worn off, we're going to try to get you up on your feet and take a few steps. At a minimum, the nursing staff will get you up to a chair later on that evening if therapy is not able to do it during the day. Therapy staff is in the building until 6:30, so if that block hasn't worn off by 6:30, the nursing staff does it later on that night. Now, on the day of surgery, you might not feel well, and this isn't uncommon. Typically, people are a little bit dizzy or lightheaded. You might be nauseated. These are all effects of the anesthetic and effects of the pain medication that they're giving you. So if that is you, if you're not feeling well, don't feel too bad. It's not going to delay your whole recovery. We work around it. We're not going to have you do anything that's not safe. We're going to give you a little push. We're going to see if we can get you up and moving. But if it's not safe, if your blood pressure is low or you're not feeling well, then we'll have to hold up and nursing will get you up later. Now, the morning after surgery, somebody will come into your room and they'll put times on your board. All your therapies are scheduled here at the hospital. You'll have 2 physical therapy sessions and 1 occupational therapy session each day that you're here. Now, if you need to get pain medication, if you want to use the bathroom, if you want to get dressed before therapy, let your nurse know a good half hour ahead of time so they can coordinate that. We don't want your session to be backed up 15 minutes and then the next person's backed up 15 minutes, the next person 15 minutes. We try to stay on a schedule so that we can provide a full therapy session to everybody and so that everybody gets to therapy on time. The morning after surgery, when we first come to see you, we're going to start your therapy session in your room unless we have walked with you the night before. If therapy walked with you on the day of surgery, then we'll bring you straight down to the gym. In most cases, therapy will not have walked with you yet, and we'll start your therapy session in your room. We're going to work on exercises, getting in and out of bed, getting to a chair, and then we're going to bring you down to the gym, and then we're going to finish up your session there. In the afternoon, we're going to bring you straight down to the gym. Now, that first day after surgery, you might not feel well still. You might be getting a blood transfusion. You still might be a little dizzy or lightheaded, and that's all relatively normal. And like I said previously, we're going to work around that as best we can, but we're not going to have you do anything that's not safe. Now, in the afternoon after surgery, when we bring you down to the gym, we're going to continue working on the same exercises, the same bed mobility. We're working on transfers in and out of bed, in and out of a chair. We're going to work on walking, and we're also going to start working on stairs if you have stairs at home. Now, occupational therapy is going to be put in there at some point. You're either going to have them in the morning or in the afternoon, whatever your schedule will allow, and they will come to your room and they'll do the treatment in your room. Now, if you're here past that one day after surgery, which most of you will be, your therapy times will continue to be scheduled, 2 physical therapy sessions, 1 occupational therapy session. The physical therapy sessions are in the gym. Somebody continues to pick you up for your therapy sessions, brings you down to the gym. You may be walking all or part of the way to or from the gym. It's not uncommon for the therapist to walk you to the edge of the gym and say, we'll see you this afternoon, and then our transporter walks alongside you until you need to sit down, and then they pull the wheelchair up behind you. We're still working on the same exercises, the same mobility. We may have you in group therapy. You might be down in the gym with other patients that are also having hip or knee replacement. Because we're doing the same instructions for you and we're doing the same exercises for you. Now, occupational therapy is also going to see you, but they may take you out of the room if you have a bathtub at home where you have to step over the side. If you actually have a bathtub where you have to step over the side, there's a few different ways that you can go about doing that. So they will take you down to our tub room and they will work on getting into a bathtub in one of those 3 ways. They're going to figure out what works best for you. That's the only time they'd take you out of your room. Some people do kind of graduate from occupational therapy. If that's the case, if you've met your goals for occupational therapy, you're able to get yourself dressed, you're able to perform those ADLs by yourself, then occupational therapy will sign off, but you will continue to have your physical therapy twice a day. Therapy is going to continue working on mobility after the surgery here. We're working on getting up and down from the chair is a big one. Now, what I tell people before surgery is to practice getting in and out of a chair without using the leg that you're going to have surgery on. Okay? You want to use a chair that has armrests, that has good support on it, that you don't sink down into. A sofa or a love seat that's wider makes it a lot more difficult to get out of because you can't use both of your arms. So if I'm going to get out of the chair, typically when we get out of a chair, we bring our feet underneath us and we bring our shoulders over our hips. Now, after surgery, you may not have the motion in your knees to get far underneath you, and you may not be able to bend over your hip. So if I had surgery on my right leg here, I'm going to practice getting out of the chair with my right leg out in front. I'm not going to use that leg to get out of the chair. That way, if you can do this before surgery, anything you get out of this leg after surgery to help you out is a bonus. So you're going to put both arms on the chair, and you're going to push yourself up to here. Once you get to this point, then you're going to start working that leg back underneath you till you get to here, and then you can stand up. Only at that point are you going to grab the walker. If you grab the walker partway, the walker is going to fall back on you and you're going to fall back in the chair. So practice getting in and out of the chair before you come in for surgery. General mobility for walking. We're going to use a pattern, and we'll show you when you come in to have your surgery, but we're going to start everybody out with a walker. The walker is going to have 2 small wheels on it. We're going to have those 2 small wheels instead of the 4 big wheels because it doesn't roll quite as easily. It allows you to still get the mobility, but it provides more support for you. So the pattern that we're going to use is we're going to move the walker forward first. We're going to take our sore leg, and then we're going to push down with our arms to take a little bit of the pressure off of that leg and bring our other leg to it. Okay? Now, when you get back to using your normal walking pattern where you don't have to use your arms to take the weight off your leg, then you can transition to a walker with 4 wheels. But we won't do it until you're able to put all the weight on that surgical leg after the surgery. Okay? There are a lot of pages in your binder that go over going up and down stairs. Stairs can be different depending on where you have railings and what assistive device you're using. So if you're using a walker and you're using a railing, your pattern for going up and down stairs or the technique that you use is different than if you're using 2 railings. So we're going to go over your specific situation when you come in to have surgery. In general, we're going to tell you go up the stairs with your good leg first and come down the stairs with your bad leg first. That allows you to rely on your good leg or the leg that you did not have surgery on to push yourself up to the next step or lower yourself down to the next step. Now when you come in to have your surgery, the first time therapy sees you, we're going to ask you about your home environment. We want to know what type of an environment you're in as far as the size. Do you live in a big house? Are you in a small apartment? Are you in a mobile home? We want to know, are there stairs to get into the house? And we want to know if there's stairs that you have to go up and down when you get home, to get to your bedroom, to get to the basement, whatever it is. And then we want to know, who do you have with you to help out? And we want to know if there's railings next to your stairs. This is all important to help customize your therapy session for you. We want to make sure that when you go home, you're able to do whatever it is that you want to be able to do, and we're confident that you're going to be able to do that when you leave the hospital. And we want you to be confident that you can do it as well. I'm going to go over the exercises that we're going to have you do. We start these exercises ahead of time. We want to do these exercises before surgery for a couple different reasons. One, makes sense to everybody, is it increases the strength in our leg. The other thing that is very important after surgery is to have good control of the muscle because pain is a very good muscle inhibitor. Pain is going to tell that muscle to stop working. It's going to send a signal to your brain saying, hey, when I contract, it hurts, and your brain's going to send the message back that says, okay, then stop working. And we have to be able to push through that after surgery. If you think about getting a Charlie horse, when you go to step down on that leg, the leg kind of buckles underneath you a little bit. And that's going to be similar after surgery, but we don't want it to buckle. We want it to hold you up nice and straight, nice and strong. Okay? So we're going to have you do these before surgery for that reason. After surgery, it's important to continue to do exercises to continue to gain strength, but also to gain mobility. The swelling after surgery is going to limit the amount of flexibility you have in that joint, and the swelling can actually cause increases in pain and discomfort. By doing these exercises after surgery, you can help limit that pain and discomfort caused by the swelling. Everybody asks, how many of these exercises do I do? And there's really no magic number. 10 is a nice round number. I tell people to try to get 10 of these, but 10 might be too difficult for some of these exercises, and 10 might be really easy for other exercises. If you get to 10 and your leg doesn't feel tired, try to get to 15. Try to add a few every day. Try to increase the amount that you're doing. If you get to 7 and it's too difficult to do another one, then stop at 7. The next day, try to get to 8. Try to get to 9. Try to gain a little bit each day. You know, you're going to have a little bit of discomfort. You might have some pain in that leg while you're doing the exercises. If you're having muscle pain is normal, and we expect that to happen especially over the first 4 or 5 days. That will go away after those initial 4 or 5 days when the muscles get used to doing the activity. Continue to do the exercises. If you're having pain in the joint, that is something we don't want. especially if there's pain in the joint when you're doing the exercise. If that's the case, then we want to modify that exercise in some way. Either don't lift the leg as far, don't bend it as far, or don't contract the muscle as intense. If you can't eliminate the pain in the joint by doing one of those three things, then we want to eliminate that exercise and focus more on the exercises that don't cause pain. We're going to start with the knee exercises. Now there's a tab in your binder that says exercises. The first section in there is for knee exercises. If you're having a hip replaced, you do not need to do the knee exercises. I'm going to let you know what the name of the exercise is. The exercises that I go over today, you're going to do before surgery. If I don't go over the exercise today, you do not need to do it before surgery. We'll go over the knee exercises first. Now the page numbers can be different depending on which version of the binder you've received. So I'll give you the name of the exercise, and then you can pause the DVD while you find that exercise, unpause it to listen to the instructions. First exercise is called quad sets, lying down. You're going to lie on your back, and you're going to push the back of your knee down into the bed. Push your knee down into the bed hard for about 5 seconds, and then let the leg relax. Keep breathing while you perform this exercise or your blood pressure goes way up. Second exercise is called terminal knee extension. In this exercise, roll a towel, a pillow, or a blanket up and put it underneath your knee. Let your knee rest on that towel, pillow, or blanket and lift your foot. This is a very easy exercise to do, so you have to perform this one slowly. And this is an exercise where you may be able to do 15 or 20 before you start feeling tired. Next exercise is called straight leg raise. In order to do this exercise correctly, you need to keep your legs straight the entire duration of the exercise. Bend your opposite leg. This will make it easier on your back. And then tighten your leg up to get it as straight as you can. Lift the leg up off the table or the bed. You only have to lift it about a foot off the bed. Lower it back down to the table or the bed, and then let the muscle relax completely in between exercises. We want separate contractions. And then repeat. The last exercise lying down is called heel slides. We're going to have you lie on your back, draw your heel back towards your butt, and then return to a straight position. This exercise before surgery should be done without any assistance of a towel or a sheet. Although after surgery, we may use a towel or a sheet to assist you in getting that knee to bend. The exercises that are performed in sitting are very similar to those in lying down. The first one is quad sets again. You can sit on a chair. You can sit on a chair, prop your leg up on another chair or an ottoman, an end table, a coffee table, and you're going to take your knee and you're going to push it down towards the floor, tighten up your thigh muscle, and then let it relax. We're going to hold that contraction for 5 seconds, and then we're going to repeat. But keep breathing while you're doing the contraction. The next exercise is the knee extension. Sit back in the chair as far as you can so that the seat on the chair is close to the back of your knee, and then lift your foot. This is an easy exercise, so take it slow. Take a little rest at the top, and then lower it back down. The last exercise in sitting is the straight leg raise. In this exercise, we want you to be all the way forward in the chair. If we sit back in the chair and we straighten our leg all the way, there's nowhere else to lift it. So we want to slide forward in the chair so we can start with the leg straight, and then we're going to lift it and then lower it back down. Again, let that muscle contract completely before your next exercise. The exercises for the hips are all done lying down. The first 3 exercises are tightener exercises to strengthen the muscles that surround your hip joint and provide support for the joint itself. The first one is called gluteal sets. This is also known as butt squeezes. You're going to lay on your back, squeeze your butt together, hold it for 5 seconds, and then let it relax. When you perform this exercise, you should feel your hips come up off the bed just a little bit. The second exercise is called quad sets. In this exercise, you're going to push the back of your knee down into the bed. You're going to hold it for 5 seconds and then let it relax. The third tightener exercise is called hamstring sets. In this exercise, think about digging your heel down into the bed. You should feel this in the back part of your thigh. Hold the contraction for 5 seconds and then let it relax. The next exercise for hips is called hip flexion. You're going to lie on your back and you're going to pull your knee up towards your shoulder. When you do this exercise, your foot should come up off the table. If you're not able to do the exercise without pain, wrap a towel or a sheet around your foot and assist with your arms. If that still doesn't get rid of the pain, then lay on your back and do a heel slide instead. You're going to put your foot on the table or on the bed and slide it back towards your butt. Don't lift it off the table. Next exercise for the hips is a straight leg raise. You're going to bend your opposite leg, straighten your leg as straight as you can get it, lift it up off the bed, and you only have to lift it off the bed about a foot. And then you're going to lower it back down to the bed and let it relax. The final exercise for the hips is called hip abduction. What this means is moving the leg away from your body. This exercise can be performed in one of 3 ways. No matter which way you do, the important thing with this exercise is that you keep your toes pointing straight forward. We're trying to target the muscle on the side of the hip instead of the front of the hip. We've already done the straight leg raise, which targets the front of the hip, but the muscles on the side of the hip help stabilize your pelvis and keep your pelvis in a neutral position when we're walking so that we don't walk with a limp after surgery. In order to perform this exercise, you simply move your leg away from your body. Okay? You can do this standing up, you can do it laying on your side, or you can do it laying on your back. Try to keep in mind the first few days after surgery are going to be frustrating for you. You're coming into the hospital able to walk by yourself, able to go up and down stairs by yourself, able to dress yourself, able to take care of yourself. For the first few days after surgery, you're going to be relying on other people to help you with that. Therapy is going to show you how to use different adaptive equipment and assistive devices to help you return to that independence. And until you gain your strength and mobility, things are going to be slow for you. The first few days are tough, but after that, the pain starts to decrease, your mobility starts to increase, and 3-4 weeks down the road, you're starting to get back to doing some normal activities. Good luck when you come in for your surgery. Thank you very much.